the strategic roadmap for South Africa's health and social development workforce. We're diving deep into the HWSETA Sector Skills Plan for 2025 to 2030. If you follow the healthcare sector at all, you know a massive transformation is underway. And this plan, well, it's the blueprint guiding that entire change. But before we jump into the solutions, we've got to start with a really critical question. Why exactly are so many crucial healthcare jobs just sitting empty? It's kind of a massive paradox, right? The demand for care is higher than ever, yet these critical positions just aren't getting filled. So today, we're dissecting the human resources crisis behind this, and we'll look at the concrete plans in place to actually fix it. Here's how we're going to break it down today. First, we'll look at the core problem and context, then dive into the hard-to-fill vacancies. After that, we'll analyze the specific skills gaps, explore the strategic interventions, and finally, look at exactly how this skills pipeline is being funded. Let's get right into it. Section 1, the core problem and context. So, first up, a quick refresher on our central player here. HWSETA is the statutory body legally mandated to facilitate, monitor, and really elevate skills development across the health, social development, and veterinary sectors in South Africa. And their vision? It's monumental. They're aiming to create a highly skilled, world-class workforce that can meet the needs of all South Africans. Now, we aren't just dealing with one isolated issue here. It's basically a perfect storm of labor market challenges. We've got severe budget constraints in both the public and private sectors limiting hires. We're also seeing a serious brain drain with professionals emigrating to other countries, coupled with workers migrating from rural to urban areas. Add to that the post-COVID-19 fallout and failing to retain staff, and underlying this whole shebang is a severely constrained academic and clinical training capacity. It's a lot to tackle. Moving on to Section 2, hard-to-fill vacancies. When we actually look at the data for hard-to-fill vacancies between 2019 and 2024, the concentration of the problem is glaring. A staggering 57% of all these hard-to-fill vacancies are in the professionals category. That's followed by technicians and associate professionals at 28%. So what this tells us is we're dealing with a massive deficit in highly skilled, specialized roles that require years of intensive training. And when we break down those professional categories even further to isolate the specific unit groups, nursing absolutely dominates. Nursing professionals make up 39% of the shortages all on their own, and nursing associate professionals add another 24%. So this proves, without a doubt, that the national shortage of nurses remains the most critical, pressing issue in a sector that is already stretched incredibly thin. Now, here is where the data becomes this deeply human paradox. You might assume that with such high public demand for healthcare, every single graduate would immediately get a job, right? But there is actually an alarming incidence of unemployed medical practitioners. Why? Well, because while the public demand is through the roof, severe budget constraints mean there's a serious lack of funded internship and community service posts. The system literally just lacks the funds to absorb the newly qualified professionals it so desperately needs. Section 3, analyzing the skills gaps. The fundamental friction in the sector really comes down to this: high demand versus low supply. On the demand side, we have expanding population needs, new national health insurance or NHI requirements coming into play, and lingering post-pandemic care demands. But on the supply side, we're facing slow graduate output, that severe lack of workplace internships we just talked about, and an education system that employers say doesn't always produce candidates with day-one work-ready skills. And hey, let's not forget that this crisis extends way beyond human healthcare. The W in HWSETA stands for welfare, and that includes the veterinary sector. This area demands highly specialized animal health and veterinary nursing competencies, which are absolutely vital for things like zoonotic disease control, which, if you think about it, is a major public health priority for all of us. Which brings us to Section 4, the strategic interventions. So the answer to this whole crisis lies right here. The 2025-2030 Sector Skills Plan is the blueprint for rebuilding this workforce. It's essentially a strategic roadmap designed specifically to build the capacity of a developmental state by matching training outputs directly with the socio-economic priorities of the country. This is how we start fixing things. To actually achieve this, the plan breaks down into 4 strategic priority actions. First, building a sustainable skills pipeline with various entry points. Second, professionalizing the current workforce and new entrants to improve service quality. Third, developing the specific vital skills the state needs for its service delivery obligations. And fourth, ensuring tight alignment with broader national plans, like the Economic Reconstruction and Recovery Plan, as well as the Medium-Term Development Plan. The crucial point is captured perfectly in this quote straight from the plan. It says, in line with the ERP skills strategy, the focus will be on the provision of work-based learning opportunities to ensure the work readiness of entrants to the sector. This is a massive shift, guys. It acknowledges that theoretical education just isn't enough. Hands-on, mentored clinical training is the ultimate goal here for producing professionals who are truly day one ready. Finally, Section 5, funding the skills pipeline. Of course, none of this works without funding. The financial engine driving this is the Skills Development Levy, and it's dispersed through mechanisms like discretionary grants. Basically, these grants provide targeted financial support from the HWSETA to qualifying organizations. They're the actual funds used to pay for specific skills development programs, things like learnerships, bursaries, and work experience placements. These grants are really deployed like precision tools, matching specific grant types to specific problems. As you can see, learnerships target unemployed or unskilled individuals, providing that crucial entry-level pipeline. Bursaries help employed workers professionalize further, or they fund NSFA students getting their formal qualifications. And then work experience grants directly solve that huge issue of unfunded posts, placing TVET graduates, disabled persons, and interns into clinical workplaces so they can actually get their practical hours. And this highly targeted funding approach, it's an absolute necessity. Why? Because an incredible 81% of all hard-to-fill vacancies in this sector are concentrated in just 7 occupational unit groups, mostly nurses and medical practitioners. By aiming these discretionary grants directly at those bottlenecks, the HWSETA is making a concentrated impact right where the system is hurting the most. So we've looked at the data, the shortages, and the strategy. But ultimately, this isn't just about dry policy frameworks. I want you to ask yourself, how will these strategic interventions and funded training pipelines shape the health and welfare of your own community by 2030?